Let's talk about Latuda, also known as Lurasidone. Lurasidone is an atypical second-generation antipsychotic. It's an antagonist of dopamine D2 and serotonin 5-HT2A and 5-HT7, as well as a serotonin 5-HT1A partial agonist. It's important to know that for Lurasidone to work properly, it has to be given with food, specifically at least 350 calories. It's typically dosed as once daily, but because it is sedating, you might want to consider prescribing it for PM dosing. It's one of the antipsychotics that has a lower risk for weight gain. For boards, know that the 3 antipsychotics with the least amount of weight gain is ZAL, Z-A-L, Ziprasidone, Aripiprazole, and Lurasidone. With all antipsychotics, we're monitoring weight, BMI, waist circumference, lipids, A1C, and blood pressure. Complete an Ames assessment at least every 6 months and more frequently in high-risk populations. Thoroughly review EPS, NMS, and TD, very important, as well as know that a black box warning exists for higher risk mortality in elderly. Therefore, antipsychotics are not approved for dementia-related psychosis. Lurasidone is FDA approved for the treatment of schizophrenia in patients ages 13 and older, bipolar depression in ages 10 and older, and then off-label use sometimes for mixed depression, treatment-resistant depression, impulse control disorders, and sometimes also in PTSD. It is metabolized by CYP3A4, so use caution when prescribing it with any CYP3A4 inducer or inhibitor like carbamazepine, which is an inducer. With Lurasidone, it's going to decrease Lurasidone levels, and then an inhibitor like clarithromycin might increase Lurasidone levels. Ask your patient about any new meds added by their PCP, and of course, these are just the highlights. Review your side effects and content.